Tim, how are you doing?
I'm alright. Yeah, how are you doing?
I'm okay. All right. So, do you want to give us an insight in terms of what you're currently doing at the moment?
As you said, I'm a medical doctor, specializing in anesthesia and intensive care. So, I'm an anesthetist or intensivist, so to speak. So basically, I take care of the most critically ill patients in the hospital, and also make sure that all patients who are going for any types of surgery are comfortable in terms of being pain-free, whether they are awake for the operations or they're asleep. They're comfortable before the operation, during the operation, and after the operation until they're fully awake and recovered.
All right. Oh, nice. Nice to know. So, just talk me through your journey from. Well, I'll give you the option to start from everywhere you want, whether you want to start from primary school. What made you make that decision moving forward to become a doctor?
Okay, currently I've been working in the UK for the past 6 years. I work in a hospital in West Wales General Hospital in Carmarthen, which is about an hour from Cardiff, for those of you who know Wales. Now, I started my primary education in the USA, actually, when my father was doing his PhD. And then we moved back to Ghana and I continued my primary education there at University Primary School, Legon. And after my primary school education, I went on to attend to Infant Swim School in Cape Coast, and completed Infant Swim School in 1994. And then I gained admission to the Bachelor of Medical Science program at the University of Ghana in 1996, completed my Bachelor of Science medical program, moved on to do my medical degree at University of Ghana Medical School, and graduated in 2004. Now, originally, I never really wanted to be a medical doctor. My original plan was always to be an architect. That's because when I was in junior high school and secondary school, I liked drawing, I liked designing things, I liked to build things. So my plan had always been to be an architect. But this is where advice from other people, mentors, and parents come in. So I initially gained admission into University of Science and Technology in Ghana to do architecture. But after talking to a number of people and talking to my father, especially, they felt that I was very strong in the biological sciences. I'll tell you more about that later. And they advised me that if I wanted to have more opportunities, I should consider a career in medicine, considering the fact that there are many different fields in medicine that I could move into if I wasn't particularly interested in doing all the bloody work and so on and stuff like that. So after talking to a number of people and listening to my father, I decided to do medicine. Now, at that time, I wasn't even fully concerned or fully convinced that it's actually what I want to do. But I knew that if I applied myself to it, I could do very well and could always go into a different field, whether it be management or research or, something of that sort. So I started my medical degree. When was this? I think 1996, soon after finishing school, secondary school. And yeah, I went through University of Ghana and ended up with my degree in medicine. And I think that's in a nutshell, that's how I finished medical school. Now, a lot happened after that. My career path to get to where I am today required a lot more training, even more than I had to go through medical school. Now, there are about 20 broad specialties in medicine: surgery, hematology, so many different fields. And anesthesia and intensive care was an area in which I found interesting. I initially chose anesthesia and intensive care because I enjoyed having to deal with critically ill patients and being able to perform numerous emergency life-saving procedures that many of my other colleagues, medical colleagues, couldn't do. And it also allowed me to provide a very pleasant and pain-free experience for patients who are undergoing surgery. Surgery can be very, very frightening, and people are naturally be very anxious while having surgery. But anesthesia allowed me to be able to do that. So, yes, what else would you like to know? I can go
Oh,
into
all right, cool.
more details if you want to.
All right, cool. Thanks for that. Okay, that's quite interesting. Hmm. All right. So my next question would be for anyone, so any young person wishing to pursue medicine. What are some of the subjects that they need to focus in?
Well, if you want to do medicine, as you know, it's a science-based career. So for those who, depending on what level you are, if you're in primary school, I think you basically have an interest in science. Make sure you have an interest in science, first of all. You don't want to do something that you don't like, you don't enjoy. And
Hmm.
so the sciences are very important. When you get into secondary school, particularly those who are going to do their GCSEs, you'd have to focus on doing at least a triple science combination. With GCSE, you can do a double science, which most people do, and you can do triple science. Of course, you can do double science, and then when you get to A levels, you can go on to a deeper science. But with the triple science at GCSE, it gives you a broader view. You're going to be doing physics, chemistry, biology, and it'll give you a broad view of what to expect. So once you've done that GCSEs, get your grades as best you can, then you move on to A levels, and you continue to do your science as well. And A levels are very important for you to be able to get into university. Nowadays, there are two different ways you can get into, well, not two, but there are a number of ways, but I know two main ways you can get into medical school. And the first one being right into medical school from secondary school. You get your A levels, apply for medical school, and you can get in right away. And right from the first year, you start at medical school. But there's also another way where you can actually do a first degree in almost whatever you want to do, whether it be pharmacy or biological sciences like I did. And after your first degree, you can still apply to get into medical school. And there's actually a third way where those who have actually pursued other careers in administration or anything could actually get into medical school as a mature student. So those are three ways: either right into medical school from secondary school, or do your first degree in whatever you're interested in, some kind of science background, and then get into medical school. Or even for those who are pursuing their own degrees as whatever, they could be accountants, they could be administrators, they could be nurses, they could be pharmacists. And after they've been working for a few years, they decide that they want to switch and go into medicine. And that's also possible. Of course, I would think that the earlier you do it, the easier. The earlier you make up your mind, the easier it will be for you. But then not everybody is sure of what they want to do at an early stage in their life. So everybody's different. It depends on an individual.
Oh, that's very interesting because I always thought that you needed to at least have biology and chemistry to pursue medicine. But regarding the various pathways that you're talking about,
Mhm.
does any individual require background in at least biology?
I'm not very, very sure about that. I mean, it depends on the level. Certainly not at the GCSE level. I mean, so if you didn't do triple science at GCSE level, it doesn't disqualify you from doing medicine. You could do the normal science, double science, and get into A levels. But I'm aware that there are people who have done other subjects, gone into other areas. You know, as I said, I mentioned administration, who have ended up doing medicine. And of course, I have a colleague now who works in the hospital with me, who was administrator for quite a few years before he went back to do medicine. Now, what that means is that in some cases, they may have to actually go back and get GCSEs in a certain area. You see, you may have to get GCSEs in a certain area. I can't give you the exact areas in which you would, but you may have to get GCSEs in certain areas, you know. So as I said, it's easier if you make the decision at GCSE level, then you make sure you tick off all the boxes.
Mm-hmm.
But if you don't do that and you pursue a different area, you can always catch up and fulfill the, tick the boxes to get into medicine.
Okay. Well, that's nice to know.
But
So,
having said that,
hmm,
as you know, when you're younger, it is a lot easier to imbibe these things and get these things done. So the earlier medicine is a very intensive course, you see, and if you aim to do these things earlier, it makes it easier for you to remember all the things you need to do. As you get older, other responsibilities come into the picture and financial obligations, and it gives you less time to sit down and read all the things you need to read. So the earlier you make the decision is definitely a better way to go.
Okay. All right. Cheers, Tim, for that.
Mhm.
That's quite interesting. So I'm more or less assuming, based on the little I know, working in higher education, that
Mhm.
for anyone that doesn't really have the core fundamental, the core background, will probably have to do some form of foundation year to build
Yeah,
up or to fill in the gaps. So
yeah,
that's quite interesting. How
yeah,
about interpersonal skills or soft skills? Because yes, someone can be very brilliant and
hmm
have the capability of absorbing all that knowledge, but what about soft skills? Because soft skills are also quite vital being a doctor.
yeah. Depending on where you train, that will be part of your training. I mean, um, as part of my training, after I finished medical school in Ghana, I was planning on doing my residency in anesthesia in the US. So um, let me just go back so that it makes it easier for me to get things in perspective. I finished medical school in 2004. I did a year of housemanship in Ghana, and then I worked in the private sector in Ghana for a year. And then after that 1 year, I came back to do my training formally in Ghana. Now, during that time, I also did exams to enable me to get a job in the USA. I wanted to do anesthesia in the USA. And as part of those exams, you do a lot of behavioral sciences, and
Hmm.
they would teach you how to behave towards patients, the importance of saying hello to them and greeting them and so on and so forth. So for the exams and to be a very good clinician, of course, you need to have good interpersonal skills. But having said that, there are so many fields in medicine which don't even you don't even have to deal with patients. For example, if you want to do radiology, you spend most of your time in front of a computer, looking at scans and so on and so forth. If you want to do research, you may do a lot of paperwork and a lot of uh, work on in the field and so on. So as much as interpersonal skills are very important, it depends on which area you're going to. Of course, if you're going to be a surgeon and you want to go into private practice, your interpersonal skills are very important because
Hmm.
people will talk about how they felt in your hands, whether they felt that you were careful, whether they felt you were nice, and so on and so forth. And research has shown that actually people who trust you will are more likely to tell other people about you and to want to work with you. They value how they feel about your honesty and your trust more than your actual skills. You see, so even if you're the best surgeon, as you mentioned, you could be the best neurosurgeon in the world, but if you have very poor interpersonal skills, nobody's going to want to come to you. And you may be an average neurosurgeon, but because people trust you and believe that you care for them and your mannerism around the clinical area is top notch, they prefer for you to take care of them. So yes, interpersonal skills are very important. You always have to make sure that you're caring, and that's where I mentioned do what you enjoy. I think the best doctors are the ones who enjoy what they do,
Hmm.
whatever field they are. If you don't enjoy what you do, you're going to go to work every morning with a frown on your face, and it becomes like a chore,
Yeah.
doing what you do. But when you enjoy what you do, it's very easy for you to have a smile on your face, and people can tell that you're happy to be there and you're happy to be with them. It just flows out of you. So, and do what you enjoy, and yeah, make sure you actually care for people. A lot of people go into medicine for money,
Mm.
you see, and they do end up probably making money, but money doesn't always make you happy. So
Hmm.
you can be a rich medical doctor, but you won't necessarily be fulfilled, and you'll probably be very bad at your job. So yeah, that's what I can say about interpersonal skills.
Mm. Yeah, I think that's a very valid point because I think we now live in a society whereby I think the primary objective to pursuing any career tends to be fixated on how much money I can potentially get rather than
Exactly.
do I really, would I really enjoy pursuing this profession over this
Mhm.
period of time? So yeah, so to have the right motivation to drive you is very important, and I think this is something that young people need to hear.
Yeah.
All right.
Yeah.
All right, so cheers for that, Tim. But coming back to the interpersonal skills, I think it's pretty obvious that, as a doctor, a practicing doctor, having a good bedside manner is key.
Hmm.
You want to, at least to a certain extent, have that interpersonal relationship with your patients to a certain extent. But
Yeah.
beyond that, what else would a young person entering into this profession require?
So, I think the most important thing that you should know if you want to go into medicine or whatever you want to achieve in academia, whatever it is that hard work and discipline are the
Hmm.
baseline or the foundation for all those things. If you want to be successful, you need to invest your time wisely. And this is at every level, whether you're in secondary school or you're in university or you're afterwards, you need to think about wise use of your time. Now, what I found, and I guess and I said before, medicine is very intense. So that
Hmm.
means you're going to spend a lot of time doing a lot of reading, right? So you need to get your priorities straight early on. Know they're going to be doing a lot of reading. Know that it's going to rely, a lot of it relies on you. You're going to
Hmm.
find people who will encourage you, discourage you, make you feel like you're not capable of what you're doing. But I think that most of it depends on what you think about yourself and what you're willing to sacrifice. And the saying goes, there's no pain without gain,
Hmm.
right? You have to be ready to sit down and to work as hard as you can to get to where you want to go. Secondly, what I would say is that you need to seek advice from those ahead of you. And that means looking for a mentor that you can discuss important career choices with. That is one thing I think we're missing in African society and so on is mentors. Because
Hmm.
if you have somebody who takes interest in what you're doing and who can show you the path, I mean, there's a pathway to get through these things. And if you tick the boxes at the right time in your life, you will be successful. You see. Now that doesn't mean that it's all hard work and no play. You need to make time to also have a balance. And that means if you've got hobbies in your life which you're enjoying, work on them. When I was in medical school, when I was in secondary school, I used to like playing basketball, and I was a part of the medical school basketball team, secondary school basketball team, and these provide a kind of um, way of escape when you're tired and you're stressed out and so on. You need to have something that you can enjoy for a period of time. But the key is balance, balance between the hard work and balance between the things of which you have, make you happy. Of course, your friends and family are also very important because your family will be there for you during the difficult times. The true friends will also be there for you during the difficult times. So you don't want to spend all your time behind your books and claiming that you're trying to focus on success without spending time with your family, your friends, and all these other hobbies that you need to spend time with. Another thing I'd say is you have to make a plan early on in your life. That doesn't mean the plan is going to fall exactly the way you want it to be, but make a plan. Failure to plan is planning to fail. And if you don't make a plan for your life, you become part of somebody else's life. And the plan the person may have for you may not be what you want. So you need to make sure that you are making a plan for your life and you're checking with yourself and maybe with your mentors to see if you're on track for that plan to take root. I've also already said that you need to make sure you're enjoying what you're doing. If you don't enjoy spending time with people, I don't think you should be thinking about being a doctor, because this is people based. You should think
Yeah.
about another career or something. So you need to make sure that you pursue what you enjoy. As we said, money is important, but it's not everything. You can have all the money in the world and you will not be happy. Another element for me, which I cannot go without saying, is my faith. I'm a Christian, and
Hmm.
the Bible says, commit your ways into the Lord's hands and you'll be successful in carrying them out. And whether you like it or not, there's a spiritual dimension to everything that we see physical, right? And you can work as hard as you want. If that's not the plan for your life or that's not your destiny, you will not achieve it. And I believe that you need to be in tune with God and find out what his plan is also for your life, and he will help you to pursue it. Then you may have made a plan for your life, and after spending time thinking about it, praying about it, talking to your mentors and researching about it, you realize that um, maybe that's not a plan for you. That's not what God wants you to do. And that's what you, and if you force yourself into that area, you may find that you may get into it, but you will not be happy. And you may have to make a career switch 10 or 15 years down the line. And you end up behind where you plan on being, you see. So for me, my faith is very important. Committing things to God and praying about them is a very important, and I still do that now. Even now, with all the knowledge you gain as a doctor, you won't always know the answers to difficult questions, and you can seek advice from friends, but you can also seek advice from God. It can help you to solve these issues. So those are some of the things I think at this point, as a young person, you need to think about. Hard work, discipline are the underlying foundation for success in almost every area in life.
Right. All right. Cheers, Tim, for that. Very, very insightful. Okay. Right. So my next question would be your journey. What are some of the challenges that you encountered, you know, in terms of your journey after you finished medical school to where you are at the moment? Especially, let's look at the context in Ghana, for instance. Working, let's say, in a department whereby maybe the needed resources are not there, or outside of Ghana, so let's say in the States or in the UK, where there's that tendency of maybe being marginalized a bit in terms of how, you know, the system's been designed. So do you want to talk us through that in terms of your own personal experiences and how you're able to overcome these challenges?
Being in Ghana, I think that it was definitely easier getting to medical school in Ghana than outside, which is naturally so. I actually wanted to go into medical school in the US, but number one, financial constraints were the major thing. You know, and getting into universities as well as a foreign medical graduate is always more difficult. So getting into university in Ghana, medical school in Ghana, was definitely an easier route as a Ghanaian student. Now going through medical school, as I said before, the most difficult thing for me was the discipline, sitting down to study, because I mean, it's between you and the exam, isn't it? The more time you spend studying for the exam, the more time you spend getting the themes right and understanding them, not just chewing and pour, as we used to say, understanding the themes, the easier it will be for you to pass the examinations. So throughout medical school, the most difficult thing was discipline for myself. I didn't really face problems with people putting you down or anything of that sort. You know, most of you are Ghanaians. It's not difficult for you all to work together. Now, after medical school, I went into anesthesia in Ghana. I think the first part of my training, which began in 2006 with the Faculty of Anesthesia, Ghana College of Physicians and Surgeons. I think I worked in College Teaching Hospital for 3 years and completed my residency in 2009. That I don't think was that difficult. Hardworking, there are people to help you out and so on. During that three-year period was the time I also wrote the exams to try and get into the US. That is where things maybe got a bit more difficult and more challenging because it was very difficult to get anesthesia in the USA. And in fact, I couldn't get into a program there. There are always some external forces which you don't know are going on, whether it's the color of your skin, whether it is, you don't know what it is. But anyway, I decided to go to the UK while I was still trying to get into residency program in the US. I decided to go to the UK because it was easier for me to get into the UK. I moved to the UK. I worked there for 2 years. I worked here for 2 years from 2010 to 2012. And during that time, then I began to understand, you know, the difference working in your home country and working in a foreign country, the kind of subtle discrepancies and marginalization and so on. And what I found in the UK is that as a foreigner, you need to prove yourself to everybody. You see, your qualifications on paper remain on paper until you can prove yourself to the person who you're working with. And of course, that's not pleasant. Somebody who's had at that time I came here, I think I've been working on anesthesia for about 4 or 5 years. So I had quite a bit of experience, but you'd be treated as somebody who doesn't know anything in a way. And you're always people are always looking at you and trying to test you and see if you're as good as what you are. So you have to be on top of your game 100%. So you have to be as good as, or in most cases, better than your colleagues who
Hmm.
maybe grew up in the UK or have some kind of advantage, So it is quite stressful, but all it can do is to make you a better person. You see,
Hmm.
it makes you read more, it makes you work harder, it makes you very careful about what you do and what you say, because people are always looking at you and you're under the microscope. Having said that, it still becomes more difficult to progress in the UK or the US as a
Hmm.
foreigner. It's not impossible, but it becomes more difficult. And this is also where your interpersonal skills come into play, because if people don't like you, whether you like it or not, people tend to think that they don't have to think about that personal side of things. But that is very important. You can be the best doctor and have the highest grades in whatever it is, but if people don't like you, it's very difficult for you to get a job in an area which you want to work.
Hmm.
So I know as people would say it's kind of bending down and, so on and so forth, but it's part of the job. You need to learn to work with people in a way that you become a team player and that people would want to work with you. If you know everything and you are rude to the nurses and you don't respect what other people say and you're not on time at work and your handwriting is not legible for people to see what you're writing, all these things will go against you, and more so in a foreign environment. So these are things which you need to consider, not just your knowledge base. It's how you interact with people, what you say to them, how you say it to them. Um, all those things come into play, you see. So that was one of the things that I found was a challenge, learning how to, and it's also a cultural shift,
Hmm.
because in Ghana, the doctors, in the long way, I mean, things are changing now, but people see the doctors as always right. People don't challenge your authority and challenge what you know. But in the UK or in developing countries, it's very much, very, very, very different. Even the most junior person can ask you questions, and you have to be amenable to answer them, which is a good thing, so you
Hmm.
don't feel as if you know everything. It helps you to
Hmm.
make sure that you're giving the right information, and you just don't, people don't just accept what you say because you're a doctor.
Hmm.
They will go and check if this is according to the protocol. So you need to always be ready to read the protocols and learn what is happening, learn the new things and find out what's going on, so you're always on top of your game. Now, I think, as I said, I was here for 2 years, and in 2012, I went back to Ghana, worked in the Kolebu Teaching Hospital once again from 2012 to 2015, where I did my fellowship, did further training there. And I spent some time working in the National Cardiothoracic Center. Now, I think I worked there for 1 year. That was also another quite challenging area, because what you realize is that no matter how long you're being a doctor for, when you move into a subspecialty, you become almost like the most junior person in the area. And once again,
Hmm.
you need to be humble and you need to learn quickly from people, whether it's from the nurses, whether it's from your other colleague doctors, whether it's from the cleaners, whatever it is, you need to learn the system. Whenever you go to a new place, you need to be humble, you need to sit down, you need to learn the system. You don't assume that if you've got 10 years experience and you walk into a new place, people are going to accept what you say right away. You need to learn the system, get to know the people, know how different people react. Some people are very friendly. Some people are very unfriendly the first time, but once they gain your trust, you gain their trust, they open up to you. So I think I learned a lot there, working there, um, doing mostly heart surgery and then working on doing chest surgery and so on. That was another challenging time in my life, because even though I had been to the UK, I had worked as an anesthetist for quite a few years. It was a new area, and you just have to be humble and learn a lot from people. In the same way, during that time in Ghana from 2012 to 2015, I also was doing some private practice, doing spinal surgery and limb replacements. That is also another subspecialized area in which you need to be prepared to learn something new from your colleagues, whether they're junior to you or not. You just need to learn and be humble. Once you're humble and you're listening to people, people will also learn to listen to you. But if you think you're the only person who knows everything and you want your voice to be heard, people will quickly ignore what you say, and it will make it very difficult for you to have an effect. Um, yeah, so once again, moving back, I think I finished the fellowship in Ghana in 2015 and moved back here in 2015, back to the UK, back to the same hospital I was before. And now I'm focusing on intensive care and research. Um, because I know the system a bit better, it makes it easier for me to fit in, but it doesn't mean that you're not going to find difficulty in progressing. It's always difficult to progress, and it's the same things apply. You need to make sure you're on top of your game, learn the new protocols as quickly as possible, um, be courteous to people, make sure that you're taking into context what they're saying whenever you're dealing with a patient or making a decision. And I think that those are the things which will make you progress, make you get as far as you can go. Um, we always need to remember that we don't know everything. There's
Mm.
always something new to learn. No matter how much you think you know, somebody will always know more than you, and
Mm-hmm.
somebody will always know something that you don't know. So learning from your other colleagues is vital. And I think that if you realize that, it'll make it easier for you to learn new things and be humble. I think humility. I'm sure I've said humble a number of times. Humility is important.
Yeah, it
I
is.
find that the more you think you know, the more you realize that there's so much more that you don't know.
Exactly.
And I find that the older doctors, the longer you are in the system, you're a doctor, the more you realize that the things you thought you knew, um, medical knowledge is changing. So you may have been practicing something for 20 years, and new research shows that what you've been practicing is wrong. You may find a young doctor who is 20 years younger than you who knows the new stuff, and the new stuff is more current and it's more effective. So you need to um, just try and learn new things all the time and never think that um, you've arrived or you're the one who knows everything.
Yeah, and this is where having a good CPD really comes into play. Continuous
Yeah.
professional development, so that at
Yes.
least you
Yes.
are ensuring that your skills are to current
Yeah.
trends. So I think that's
Yeah.
that's very important for people to know.
Yeah. Yeah.
How
I.
about how
I
about
mhm.
oh, how about your achievement? What are the things that at least during your journey as a doctor, what are the key elements that you're really proud of attaining?
um. Well, I guess there are a number of things. Some big and some small. Um. Maybe they're all small, and I see them as big. But anyway, starting from secondary school, I think that one of the things which made me really proud and made me believe that I could do medicine was in my final year in senior secondary school, when I was able to get the prizes for the sciences, physics, chemistry, and biology at speech and prize giving day. That really made me proud and made me feel that um, I could do medicine. And at that time, as I said, I wasn't really interested in medicine, but because of that, people started telling me, oh, I should consider a career in medicine and so on. And even though I still wanted to do architecture, I guess that led to me doing medicine in a way as well. Um, Another thing I would say I was proud of was I was always proud that I kept my sports activities up. I think that makes you a more rounded person. Not I wouldn't say complete.
Mm.
And I had always been interested in basketball. And while in secondary school, I was a member of the secondary school basketball team. And I think that time we were able to beat our arch rivals at that time. So I was really happy about that. And I continued to play basketball throughout medical school. So yeah, I was that gave me a lot of joy outside of studying, and I really liked that as well. In medical school, another thing I think which I enjoyed and I think was an achievement, I was also a member of the Medical Students Association, and I was the exchange officer, which meant that I was in charge of um, making sure that we had exchange programs going on between um, different medical schools. And we had people coming from the UK, from Germany, from Canada, from the US, from Holland, from many different countries. And that was really enjoyable. I think I did a good job, and I helped to expand the number of slots we had for people coming to Ghana to do exchange programs. And it also involved a lot of traveling. So I really enjoyed that. I think that was something that I always talk about and I was proud of. Coming to the UK, um, since I moved here, my focus has been on intensive care and research. And research takes time. It's much longer than you think, to find out new cures and stuff, 5, 10, 20 years. And it's a very meticulous process. But anyway, in recent years, the research has been going on. And I think one of the things I'm proud of is being able to present some of our research findings at some international conferences. In 2017, was able to present some of our research findings in Geneva, Switzerland. In 2018, presented some more findings in Copenhagen in Denmark. In 2019, I think we went to Vienna in Austria to present some more findings. And the research is ongoing. We're getting more and more information. 2020, we were supposed to go to Barcelona in Spain to present, but because of the pandemic, everything's changed. That didn't come on. But hopefully in 2021, we'll be able to do some more research and hopefully come up with some groundbreaking information. And that's one of the things I've been proud of. I think an achievement which will keep me going on.
Yeah, that is an achievement, being able to, undertake research and have it presented and have it being acknowledged by your peers. I think that's very, very good, very, very good achievement.
Thank you.
How about your plans moving forward? So in terms of where you are today, what are your intentions moving forward into the future?
Yeah, so as we said about progress, in your career, one thing that I had to do when I moved here was kind of like take a step backwards, in the sense that in Ghana, I had completed my training and I had a consultant job, and I was more or less at the top of my training. But moving back here, moving to the UK, unfortunately, I couldn't get a consultant job with my qualifications from Ghana, which means that I had to do all the exams, postgraduate exams in the UK all over again in order to get to where I was in Ghana. So that is what I'm working on now. There are 4 exams, and this just goes to show that as a doctor, the exams and learning never stops. There are 4 exams I have to write to get a consultant post here. I've been able to write 3 of them. I'm hoping to do the last one this year. And hopefully within a year or 2, I'll be able to qualify for a consultant post, which is kind of like the highest post you can get in the NHS as a medical doctor. So that is what I'm hoping to do in the next year or 2. And I am very interested in teaching. And the more you teach, you're a lecturer, so the more you teach, the more you understand the subject yourself. So I'm hoping that once I get a consultant post, I'll be able to join the board of examiners for the Royal College of Anaesthetists in London, to be able to help train other doctors, and also to join the Ghana College of Physicians and Surgeons as an examiner to help train doctors in Ghana as well, in anesthesia and intensive care. So that is my one of my goals and my plans. The learning never stops. And as I said, already mentioned, research is an area which I'm interested in. So I hope to continue with the research and publish a few papers, start some collaborations between the UK and with Ghana as well, so that we can foster research in that direction. Interestingly, human beings are the same, but they're quite different in terms of how medicines work on them in different treatments. And you find that what works in the UK doesn't always work in Ghana, and what works in Ghana doesn't always work in the UK. And there are reasons for these things, but you need to find them out. That's where research comes in, see what works here and why it works, and why it doesn't work in Ghana, and vice versa. So those are 2 areas which I'm working on.
Oh, cool.
Takes a lot of time.
Yeah, because I think, at the end of the day, the challenge will be different, particularly, when it comes to resources. There's also the cultural element. There's also the socioeconomic elements too, when it comes to, working in different countries and trying to correlate where's that point where, that commonality can be established, and what creates that distinction, in terms of, how things are practiced. So that's quite interesting. All right, because I think, because I've allowed you to speak, you've literally, covered a lot of ground, which I really appreciate. But just to go back to your journey, when you were studying for medicine, what are the areas that you really enjoyed in terms of your university experience and to where you are at the moment? What are the things that you really enjoyed learning?
Well, one of the things that I really enjoy is helping the patients to get better. Along your journey, you're going to lose some patients. Some patients will not make it. Death is inevitable, unfortunately, for all of us. So it's important that you don't let the failures, so to speak, overarch or crowd out the successes. And it was always nice to meet a patient, maybe at the outpatient department with a certain problem, be able to diagnose that problem and follow that patient along their journey through surgery or whatever it is to the point that they are better. And there's nothing more gratifying than a patient coming back and saying, thank you for all the help you did for me, and so on and so forth. And even if things didn't go as well as the patient hoped, the fact that they come back to say thank you for just being there as a caring person, talking to them about it. Sometimes we underestimate the importance of mental health, you see, and just being able to talk to the person, explain to the person what's going to happen in the hospital and what you expect, it can make their journey so much more pleasant than somebody who come. I mean, one of the things that human beings are most afraid of is the unknown. When you don't know what's going to happen, you don't know what to expect, it becomes a lot more difficult to go through. But when you know what to expect, and what's going to happen here and what's going to happen there, and when you're going to come back for this test and why you need to do this test. So that was one of the things which I really find joy in. And I chose to do anesthesia because I like the one-on-one nature. A lot of professions, a lot of medical professions require you to deal with maybe 20, 30 patients a day, or even 20, 30 patients at a time. But with anesthesia, most of the time, you are dealing with one patient at a time. You take the patient into the theater, you talk the patient through what you're going to do, you anesthetize the patient, you stay with the patient through surgery, you make sure the patient wakes up after surgery until the patient's awake and comfortable. So it's more or less one-on-one for most of the time. And that's what I enjoyed, giving a lot of detail to one person at a time. Of course, you may have to do 4 or 5 of those patients in one day, but still you're able to focus with one patient at a time and give your best possible treatment to that patient. So I always enjoyed that one-to-one quality time with the patient. I've always enjoyed that, and you get to know the patient better. And the same thing with intensive care. When you're present in intensive care, and I guess that this pandemic is very pregnant at the moment. With this coronavirus going on, you tend to have patients in intensive care for much longer than we used to. I mean, if you take the common flu, you have somebody who's in intensive care for maybe a week with the flu, 2 weeks. But with coronavirus, you could have a patient in a ventilator or in the ICU for 3, 4, 5, 6 weeks. So you get to know the patient very well. I mean, everything about the patient. You get to know the history of the patient. You get to know what's going on now. And that's one thing, as I said, I enjoy getting to know one patient very, very well, and knowing all the labs about the patient, knowing the inside and out of the patient, and be able to make minor adjustments to help the patient to survive. So yeah, that's I hope I've answered your question, but that's what I enjoyed. I don't know if there's anything else in particular you were and another thing I enjoyed medical school is, you see, as we said, hard work pays off. But Rome wasn't built in a day. It's a little bit at a time. So it's important that you pace yourself whenever you're trying to achieve an aim. You work hard and you find time to relax and play hard, do the things you enjoy. And for me, that was what gave me impetus to keep on going on. If you work too hard and you get tired, it's very difficult for you to get back to your books the next day. But if you decide, okay, I'm going to study for 4 hours today, and after 4 hours, I'm going to watch a movie, play basketball, go out with my friends for another 4 hours. It makes it easier for you to plan. I think I mentioned before, planning. You plan. So if you've got a week, you plan, I'm going to study today for 4 hours. I'm going to chill for 3 hours. I'm going to study for 5 hours tomorrow. I'm going to chill for 2 hours. The next day, I'm not going to study at all. I'm going to chill. So having that kind of plan of your life, and making sure that you're making time to do things that you enjoy, it keeps you going. It keeps you going on. It keeps you going on. And of course, when you're successful and you do well in the exams, and patients come and say thank you, and maybe your finances are going well, it motivates you to do it more and more, and to get better and better at what you do. And in the field of medicine, I think that it's kind of a blessing, in the sense that the more you study and the more you practice, the better you get, and in a way, the better your results get. So it's a reverse vicious cycle, in the sense that you do what you're doing more and more frequently, You get better and better at it. You get financially rewarded for it. You get emotionally rewarded for it, and it spurs you on to do more and more and more.
Mm. All right, cheers for that. And what about the counter to that? What's some of the things you really didn't like during your journey?
Well, that's easy. I mean, the failures, failing exams, which you're bound to
Mm.
fail exams sometimes, losing a patient. Sometimes, the patients who you think are going to survive are the ones who die, and
Yeah.
the ones you think are going to die are the ones who survive. And it's always an enigma. And that is where, for me, my faith also came in, because I realized that no matter what you do, man is finite. You can never know everything about the human body.
Mm-hmm.
You can have a professor who's worked in the same area for 50 years. There's no way he knows everything. There's always an element which we don't know, you see. And I think it's important for us to realize that we don't know everything and we don't have all the answers. Nobody who says who has all the answers is telling the truth. So yeah, it was difficult. The failures were difficult. Losing patients has always been difficult. Sometimes sitting down for hours on end is not nice. But the thing is that if you, I keep on coming back to planning, if you plan it well and you're studying regularly, it makes it easier for when the exams come up. But if you don't study and you chill for half of the semester, and then when the exam's coming up, it's going to be much more difficult for you to put all that stuff into your head. So the initial days, I think it was difficult sitting down for hours. But then as you get into the groove and you realize that what needs to be done becomes easier. Yeah, so those were the things I didn't really enjoy. Of course, moving to the UK, you don't enjoy being looked down. Look, how do I put it? I mean, people assuming you don't know things and talking to you, in a very patronizing way,
Mm-hmm.
And I mean, of course, there are ways to deal with that. You just need to be patient and then prove yourself one step at a time, and the people know that you. But there's no way of faking in
Yeah.
this profession. If you don't know, you will be found out.
Yeah, you will
So if
be
you don't know
exposed.
something, you need to, yeah, you'll be exposed. If you don't know something, you need to go and read it and make sure you know it, so that you can apply it to the field. So it's not nice being put in a position where um, you don't know something and people are trying to show you that you don't know. For me, it just makes me go back and read and make sure that next time I know, and
Yeah.
I will make it abundantly clear to you that I know
Yeah.
what I'm talking about when I know.
Exactly.
When I don't know, I'll keep quiet and I'll listen and absorb. But when I do know, I'll let you know that I know, and this is what we're going to do. So
Yeah.
yeah, it's uncomfortable, but you just use that to spur you on to get
Yeah.
better and better.
Exactly. Exactly. Because again, you need something, and that's the one of those things that you need to see the positive and the negative, something that will drive you, something that will spur you
Yeah,
on to step up
yeah,
your game. So
exactly,
yes, I think
exactly.
that's worth everybody considering. So there's the fact that there are these barriers
Hmm.
placed against you to make it difficult for you to hurdle. At least use that
Hmm.
as that incentive to prove your capabilities and your potential. So at least
Yeah,
that's very 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 good to hear.
yeah,
So hopefully anyone that watches this at least will take that as an incentive to challenge and progress themselves to get
yeah,
to the next level. So
yeah.
yeah, so that's very good, well said. All right. I think we're getting close to finishing this interview, and I'm hoping that once this project kicks off, there will be opportunities to probably do a live Q&A session, particularly from young people that want to get into this particular field.
Mhm.
So, on the closing note, what would be, final words of wisdom you want to impart to anyone that wants to pursue medicine or any of the specialist areas within this field?
Mm. Well, to go back to what I said before, make sure you enjoy what you're doing. If you enjoy science, you enjoy biology, you enjoy people, then yeah, medicine is a field for you. Don't just decide to do medicine because of the money.
Mm,
There are a lot of other ways to make money. Make sure that you enjoy what you're doing. Um, Secondly, you need to take what you're doing now seriously. Some people think that, oh, I'm going to chill now, and when I get to medical school, I'll be all serious about it. How are you going to get to medical school in the first place if you're not serious now?
mm,
You see, so when it's time for you to study, do the studying and do it properly. There are a lot of things that people will be learning in secondary school or university now, which will be running things that will be, you find that the same thing you're going to learn in medical school, but you're going to learn them to a deeper level. You see, so whatever you're learning now in science, take it seriously, learn it properly, understand what you're learning. Don't think that you can just read it and pass for an exam, because you're gonna come back to it in 3 or 4 years. And if you learned it properly the first time, it becomes much easier to build on it. But if you just did it in a shabby way, you managed to get the past questions and you just pass the exam, and you're gonna come back to it and you're gonna be found out. As I said before, there's no hiding. If you don't know it, you'll be exposed. So I'll just say, plan your time now. If you want to do medicine, do the research, find out what you need to do to get into it. Take your sciences seriously. Get used to the fact that you work hard, you're going to get results. Take time off to enjoy yourself when you're not studying, but make sure that you've got a plan, you've got a focus, you've got mentors, and you're working one day at a time at achieving your aims. That's what I would say.
Well said. Well said. Very inspirational words of wisdom, so to say. So I think, yeah, we've come to the end of the interview, and as I inferred, maybe when things kick off, we could probably organize a live Q&A session, inviting people who are interested, particularly people of African or of the Black persuasion, because that's the demographic that I'm really trying to target, because we're very few in numbers, particularly in the Black diaspora. So hopefully, so even though it's open in terms of inclusivity, so anyone can come in and participate. Hopefully, that particular demographic will be touched for them to at least be a bit more curious, rather than them thinking that they are limited to what's been exposed on TV. So yeah, so I'd like to thank you at this point, Dr. Sibiberkon, for dedicating some of your time today and having a chat with us. And hopefully we can do this another time.
No problem. It's been a pleasure. Thanks for having time with me.
Okay. All right. Cheers, Tim.